So many people are looking to live happier, more stress-free lives. We provide interviews from mental health experts across various fields because we know finding quality information isn't always easy. Let's find more sanity together. Welcome back to Sanity Podcast. Today we have Dr. Erica Rozmid to talk about dealing with high-intensity emotions, uncertainty, and disappointment, utilizing both dialectical behavior therapy and cognitive behavioral therapy. The topics talked about today are useful for various situations and age ranges and can also help with coping with the impacts of COVID-19. Dr. Rozmid is currently a postdoctoral fellow at CBT, Dbt California, and Harbor UCLA with clinical research and academic backgrounds at Stanford University, NYU, Kaiser Permanente, and Lincoln Medical and Mental Health Center. She has collaborated with Matthew McConaughey's Just Keep Living Foundation and the University of Southern California's Physician Assistance Program to help provide underserved high school students on ways to cope during COVID-19. She also contributes to a weekly blog to assist parents during the pandemic and conducts research and has presented at the Associations for Behavioral and Cognitive Therapy and the Anxiety and Depression Association of America. Now on to the interview. All right, Erica, thanks so much for coming on the podcast. I really appreciate you taking the time.
Yeah, thanks so much for having me on. I'm looking forward to it.
Yeah, so one thing that I decided that I wanted to try and do at the beginning of these podcasts is to have people talk about their therapeutic approach briefly and explain why you think that's the way to go.
Yeah, totally. So I definitely identify as a cognitive behavioral therapist and a dialectical behavioral therapist. And so the acronyms for that are CBT and DBT. Primarily for both of these treatments, they are evidence-based. They're the gold standard. What that means is that there's a lot of research backing the effectiveness for these treatments. CBT really focuses on looking at the connection between your thoughts, behaviors, and actions. So an example of that is, let's just say you fail a test, or your child fails a test, or you fail at something at work, and that's the situation. One thought you could have is, shoot, I really screwed that up. And that's connected to perhaps an emotion of feeling really sad. And behaviorally, that can look like, because you have this idea that you screwed up, maybe next time you're not going to speak up at work or you're not going to study for your test. So I really work with kids, teens, and adults to challenge the thoughts and do different behaviors to change the emotions.
Mm-hmm. Okay. And then, so CBT is more based in changing the way that we think and then also changing the way we behave to change our beliefs. Like under our deep beliefs, so we're happier and healthier and reacting and acting better. So now, what's DBT?
Yeah, so DBT is really kind of one step forward. So if you think about a thermometer of an emotion, let's just say there's a thermometer of emotions from a scale of 0 to 10, and 10 is the most intense you've ever felt of anger or sadness, and 0 is not at all. When we get to an emotion of an 8, 9, or 10, so that's really intense emotion, it's really hard to challenge our thoughts or beliefs. If you think about the last time you were at your 10 out of 10 emotion and someone asked you to challenge your thinking, it's really freaking hard. So when we get to a 10 out of 10, some people may act more impulsively, and DBT is really about regulating emotions so that you can use more of those cognitive behavioral techniques.
So you're telling me that when people are really emotional, they're not rational? I've never experienced that in my life ever.
Yes. I always say, show me a person who's at a 10 out of 10 of emotion, and challenge your thinking of like, are you actually making rational decisions? I have not found that person.
And I'm thinking about earlier times in my life where somebody was really mad and I was like, oh, maybe you should be acting differently. And that didn't go well either. So
ever, right? I think challenging when you're at a 10 out of 10 is just super ineffective.
Okay. So it sounds like maybe your model here, and you could tell me if I'm getting the bridge correctly, is that you use these DBT or things to like calm down the emotion when emotions are really hot, and then use that afterwards when the person has less emotional intensity, to use the CBT skills to work through like evidence to change and see if they're thinking correctly, or look at ways that they could act differently that's more beneficial to them emotionally and actually like in their environment.
Yeah, exactly. And really, DBT at first, dialectical behavior therapy, was created for people who had more suicidal behaviors and more self-harming behaviors, but now it's actually been adapted for people with anxiety and depression. So I really like the concept. We all get to a 10 out of 10. So I really like that framework of using the cognitive behavioral therapy techniques when you're at a 7 or below of emotion.
Okay. And, I'm much more of a CBT guy. Like I know about DBT and probably more than the average person, but I wouldn't say that I'm an expert in DBT at all. So I was actually looking forward because I know that from my understanding, is that you came from more of a CBT background and you're learning and you've gotten more mastery of DBT and you've learned how to marry them together.
Yeah, exactly.
And that's something that I've been wondering as well. If I do, which I'm trying, actively learning DBT now, how do I marry it with the CBT? So I think that's going to be like interesting to hear what you have to say about some of these strategies you're going to talk about today.
Yeah, very cool.
Yeah. So it sounds like you've been doing some really cool work out in California. I know one foundation, and I forget the name, but I know it's Matthew McConaughey's foundation. Yeah,
it's the Just Keep Living Foundation.
Cool. And it sounds like, was there another foundation or organization too that you were working through, or was it just that one?
Yeah, so it's that one. There's also, I've been working with University of Southern California's. They have a pipeline program helping underserved children. And I'm also going to be working with a couple of other nonprofit foundations in the LA area. Oh,
cool. So like, what is the work or that you've been doing like for them? Like, what are these presentations or workshops about?
Yeah, totally. So basically, once the pandemic started, I think a lot of high school students have been really struggling to cope during this time. And so part of my initiation working with these organizations was really to give my resources and reach out to them to provide their foundation, their high school students, teachers, coaches with coping skills during the pandemic. But what I really love about the work is that these skills are really helpful for pretty much any human being. And so I'm able to tailor the presentations and workshops to whichever audience I'm really working with.
All right. And is it really like just skills that help with like this unique COVID situation, or is it more like able to just like for people to work on anything?
Yeah, it's really for anything. I mean, I've adapted some of the skills of how to use it during the pandemic, but I actually, when learning these treatments, I use these skills on myself all the time. And so I just thought about, okay, well, what am I struggling with right now during the pandemic? What are things that I've really had to face, and figuring out how other people are struggling too. But really, these skills can be useful for any point in your life from 5 years old to 90 years old.
See, I love that you said that you use them on yourself, because the way that I've been trained, and I think in our models, is that the best way to become a good therapist is to use the skills yourself.
Yes. Yeah. It's definitely hard in the moment when you start using the skills yourself, because I have to recognize when I'm at my 10 out of 10 of emotion. But I actually use the skills, and then I'm not just preaching, I'm really practicing the skills that I'm teaching my patients.
Yeah. And I think it actually gives you like empathy and insight as to the barriers or problems that other people might get into trying to implement the skills, because you get it. You've been there and you've been like, oh, this is so hard to do right now. Like, what's the point?
Exactly. And even noticing that I forget to use the skills, I think that's where I have the most empathy of like, oh my gosh, I totally missed that. And I know them so well. I teach the skills and I still forget to use them sometimes. Yeah,
no, exactly. So you think about like, if this is something that you talk about or I talk about like for hours a day, and we don't use them, or we forget to use them, or we choose not to use them at times, you can imagine someone who has working in a totally different field that might also be parenting or doing a whole bunch of other things, maybe not being as like, I guess we use the word compliant, but like using the skills as often as they probably could, and it very understandably.
Right. Yes. Yeah. So it definitely has built my empathy around that.
Yeah. All right. So in these talks and workshops that you have been doing, what have you what are the skills and the problems that you've been focusing on?
Yeah, so there's a couple of different skills. I think one question that I really like to start off with, and this is primarily in terms of fear, to ask like, what's your worst fear? Like, what's the catastrophe in your mind about what you're experiencing right now? And that's related to the pandemic, but we have fears all the time. And so when you get to the core of what your primary fear is, then you can ask yourself, can I work on this? Like, do I have control over this? And if the answer is yes, like, let's problem solve this. If the answer is no, if you don't have control over it, that's really where the DBT skills come in on how to tolerate the things you can't control. So I like to start off with that question of, what are you really fearing right now? Do you have control? If you have control, let's problem solve. And if you don't, let's figure out what you can do instead.
And if I'm sitting here wondering, like, well, how do I know if I have enough control or not? Like, that I should be doing, these skills that you're talking about. What would you say?
Well, so I would say, one, it might be trial and error. So you may be trying to solve the problem. And if you're getting stuck and if it's not working out, then you're probably fighting reality and you probably don't have control. Mm-hmm.
Okay. So, what ways are you talking to people about? So now I'm here, I'm at the 9, I'm at the 10 of emotions. I feel like I'm not in control, or other people are telling me like, you're not handling this well. What is it that you're teaching people to do to help bring that down?
Yeah, so let me give you an example with me when the pandemic started. So as you can tell, I'm working from my bedroom and I didn't have a desk that I could use. And so I started using my side table, brought it into my bedroom, had to stack a bunch of books. And I was so uncomfortable. In my mind, I was thinking, sure, there's a pandemic, but I'm going to go back to work in 2 weeks. So already I've kind of had an idea I was fighting reality because I just wasn't really changing anything. I was just in pain, annoyed at the world, and convinced myself this would only last for like a week or two. But then once I started to actually accept what was going on, I could actually change my situation. So I really had to accept that I was working from home. So I went with my husband to his work. We took his desk, we took all of his equipment, and I have this work from home setup, and I'm much happier. So I think there's the part of teaching high school students and teachers and coaches, like, where are you getting stuck? That's the main part. Where are you really getting stuck? And trying to kind of tease apart the reasons why they're getting stuck. So for me, I was really getting stuck because I was annoyed and in pain. And then I realized it's because I was actually not fully accepting what was happening.
Mm-hmm. And I always say acceptance is not an easy thing, because it's easy to accept things that are fun and positive and pleasant, but we're asking people to accept things that they don't want to, that are like uncomfortable or make you feel really bad. So how do you help someone accept a situation that they don't really like?
Right. Well, I think the first thing is to really validate that this is one of the hardest skills. This is my favorite because it actually can be so life-changing, but I think it's one of the hardest. So really just to know that we're all fighting reality on something. And so sometimes I'll give really small examples. I think if we start too big, we lose people. Mm-hmm. So maybe a smaller example would be, I'm on the way to work, and in LA, there's a lot of traffic. So if I look on Google Maps and it looks like I'm going to be 5 minutes late to work, and I start swerving into lanes, trying to get to work faster, and I'm getting more anxious, I'm getting more stressed, I'm getting more overwhelmed, my Google Maps time is not changing. And the acceptance part is just taking a step back and saying, okay, I'm going to be late.
Okay.
So that's a very small example, but the first step is noticing and acknowledging that you actually are fighting reality.
Mm-hmm. And is there anything else that people could do besides just saying, well, I just need to accept this? Is there a way to help them bridge it to get them more willing to accept or that it actually sinks in?
Yeah. So I think the first part is noticing that, okay, there's something that I don't want to accept here. And it makes sense because there's a lot of negative emotions around it. And part of this is if you accept it, you can actually figure out what you can change. But accepting does not mean agreeing or liking or approving, right? Accepting is just saying, this is my current situation. You can actually use, dialectical behavior therapy uses a lot of mindfulness. And so where mindfulness comes in is you can actually, close your eyes. Once you've identified what you're fighting, you can actually, and part of this is a little bit CBT as well, of rehearsing, behavior rehearsal. In your mind, you imagine, what would I be doing if I fully accepted the situation? Mm-hmm. What would I be thinking? What would I be doing? And actually imagining yourself doing and thinking those things.
So it sounds like you're saying that acceptance doesn't mean to accept and do nothing.
Exactly.
Okay, because I think when people hear acceptance, it sounds like, well, you're telling me just to say, well, this is how it is and just deal with it.
Yeah, I think so. Sometimes acceptance can be enough. And I'll give you an example of that. But what I'm talking about right now is really acceptance is the vehicle for change. Mm-hmm. And sometimes acceptance is enough.
Okay. And I forget, there's that DBT mantra, which I'm forgetting right now, but does that tie into this?
Well, there's, I'm trying to think of what mantra you're talking about, but there is talking about like using your wise mind. I don't know if that's what you mean.
Give me strength to,
like the AA prayer type of thing. Is that what you mean?
Like give me strength to
accept the things I cannot change. And now I'm forgetting. Yeah, but yes, it's the wisdom to know the difference.
Yeah, the strength to accept the things that I can't change the things that I can, and have the wisdom to know the difference. And I'm butchering it, but it sounds like that is kind of in line with what you're talking about here.
Yeah, I think that's definitely huge. So, and let me give you an example of when acceptance might be enough. Mm-hmm. So and I'm going to go back to this emotional thermometer. So when your emotions get to a 10 out of 10 and you have an urge to do something that isn't effective, you may have an urge to yell at your partner, yell at your kid, engage in self-harming behaviors, binge eat to self-soothe. Any of those things can maybe happen when you're at a 10 out of 10. So instead of acting on that urge, there are actually techniques that you can use to reduce the emotion, which will reduce your urges. Mm.
Okay. And what sorts of techniques are you talking about?
What do you do?
What are these techniques? Let us know.
Yeah. So, okay. So this is one of my favorites. Mm-hmm. And if I, didn't have some mascara on, maybe I would do it right now. But part of so there's a skill called tip the temperature. And basically what you do is you get a big bowl where your whole face could fit in it, a big bowl of ice cold water, maybe put 10, 15 ice cubes in, and you put your entire face into this bowl of ice cold water, and you hold your breath for 30 seconds. It activates the dive response, which is actually, mammals have this. And if you've ever been scuba diving, this actually activates as well. And basically it's the body's way to conserve energy. Your organs start to kind of shut down in a way. So if you're at a 10 out of 10 of emotion and you do this for 30 seconds, most times for most people, it will bring you down to like a 5 or 6.
How many seconds did you say?
30 seconds. When I tried it out, I only lasted like 15.
Yeah, I don't know if I could hold my breath for 30 seconds, but I haven't tried since I was like 10.
So it's really hard. It's so cold.
And I'm assuming you could take your head in and out as needed?
Yeah, so you could try it like over and over again. I actually made my husband try it out, and his heart rate went from a 75 to a 43.
Wow. In 30 seconds?
In 15 seconds.
In 15 seconds.
Yes.
Let's say after 30 seconds, I'm dunking my head in this ice cold water, and I'm still like, so I went from a 10 to a 8.5. Can I just do it again? Like repeat this? Is there a problem if I do it like multiple times?
So actually, then it's, if you go from a 10 to an 8.5, then it's actually done its job.
Okay. All right. So what's the goal? What's the goal? Like what's the maximum minimum goal here?
Well, the goal is to not act on the urge that you have when you get to a 10 out of 10. It also can help bring down. So if you go to an 8.5 out of 10, you could try it again. It may not work. You could try other skills, and which I'll go over in a minute. There are some skills like self-soothing, using your 5 senses to actually feel good. Mm-hmm. And then the other part is if you're at an 8.5, it may just be tolerating that moment until it comes down, because whatever goes up must come down, until you get to a 7. And then you get into more of the change or problem solving behaviors. Unfortunately, dunking your head in ice cold water does not solve your life problems. That
is very true. It just helps you bring it down so maybe you can solve or accept. It sounds like solve or accept are two major pathways. And just a concept for everybody to know, the body doesn't like to physically go up and down at the same time. So say that someone's getting anxious and their heart's starting to race, they're breathing more heavily, they're getting tense, they're sweating. If you could start bringing a physiological reaction down, the body doesn't want to be up and down, so then it starts pulling everything down. Yeah. And so I think that's what you're talking about here, that you dunk your face in the water, it slows down physiological processes, and so the rest of the body has to come down with it, because that's just what the body does.
Yeah, exactly. And because, earlier when I was talking about thoughts, behaviors, emotions are all connected, because these physiological symptoms are down, now maybe you're not having as negative thoughts. Maybe you're not having those urges anymore. So it's all connected. I really see it as if you can disrupt the model of emotion, behavior, thoughts, physiological symptoms at any point, you've disrupted the cycle enough where you can actually start changing the way that you're thinking.
Mm-hmm. And I think a lot of people have learned or heard about deep breathing, whether themselves or kids, or everybody knows about deep breathing. Kind of the same principle here: bring down the physiological in order to bring down the emotional.
Yes, exactly. And you could do, actually, part of this skill is paced breathing. There's another component where you could do paced breathing. Sometimes I know, if people are more anxious, sometimes it's hard to engage in the paced breathing. So the tip the temperature, that's what it's called, I think is the fastest way to bring it down. And then maybe you could do paced breathing after.
And anything else that's in this tip to temperature model besides the paced breathing and the cold water?
Yeah. So there's T, which is for tip the temp. The I in tip is intense exercise. So this is where you can actually, let's say you're ruminating in your mind, where you keep thinking about maybe saying something in your friend group that you didn't mean to say, or you got fired, or you got broken up with, and you keep ruminating in your mind, and it's increasing your level of emotion. Intense exercise may mean going outside, running as fast as you possibly can, or doing as many jumping jacks as you can for a few minutes to get you're actually getting your heart rate up, but you're so focused on what you're doing that you're no longer thinking about the thing that got you really stressed out.
And I would imagine that you're actually burning energy too. So that's part of, because after you work out, work out intensely, everything drops. So it's almost like we use that diver response with the cold water to bring everything down, or we bring everything really up physically through exercise to then at the end have the drop down effect and bring you down.
Yeah, exactly.
And then does the paced breathing work on the same like principle? It's just sort of, and what's the difference between, obviously paced breathing means that you're just at a regular pace and deep breathing is slower. But why use paced versus deep breathing?
Yeah, so for the paced breathing, there's actually two components to it. There's paced breathing with something called progressive muscle relaxation. So this is also very much in line with a CBT, cognitive behavioral therapy technique, where if you're able, the whole point of the paced breathing is to really have the exhale longer than the inhale. So when you're breathing in, you actually want the exhale to be longer, which will slow your system down. And a lot of times, physiologically and physically, we tense our muscles when we're stressed. So progressive muscle relaxation is a technique to squeeze and tense your muscles and then release them. So you're forcing your muscles to relax by tensing them up. And both of those paired together can create this really nice calming effect.
Okay. So that's the tip to temperature sort of technique and area. And
exactly.
Is there anything else, like, is that the main focus of these talks, or have you been going into other areas as well?
Oh yeah. So I definitely have been going into other areas. I think this is the first one. If you are feeling kind of paralyzed and don't know what to do, this skill is just a really nice way to get grounded. But there are some other skills that you can actually do to feel good. Right? Like, these skills may not make you feel good. They might just make you feel less bad. So I also think doing something for yourself, one thing every single day to create some positive emotions will be really, really helpful. So one skill I teach is about using your 5 senses to actually get grounded and create some positive emotions. Like, one example is burning your favorite candle and just watching the flame, taking a bath, eating something. And there's even so far to go, like, if you're going to eat your favorite ice cream, rather than mindlessly eat your ice cream and perhaps eat the whole pint without even knowing, there's actually a way where you can be more mindful about the eating so it actually feels good and tastes better.
And, mindfulness meditation is like a hot topic now, just like in society. And for those of you guys that ever did like Headspace or parts of the Calm app, like that's generally mindfulness geared. So you might not know that you've been doing mindfulness meditation, but you have been. I would imagine that if you practice mindfulness meditations, it would make you better at this part where you're doing like the 5 sense grounding, which sounds like a mindfulness grounding, or eating mindfully. And it sounds like taking the bath. It's kind of just like being in the moment and experiencing it rather than having your mind thinking about everything that might be worried about.
Exactly. I think, for food, people have sometimes a trickier relationship with food. So it's like, if you're going to go and eat something, you might as well enjoy it, right? Rather than feel shame about it after. And so the mindfulness is just being really aware in the moment, what's going on around you, what's going on inside of you. And for the mindfulness that we talk about in therapy, it's really about focusing your mind on something like your breath, but then also expanding your mind to know what's going on outside of you. And both of those things together can actually, there's so much research to show that having a mindfulness practice, not necessarily meditation, but just some type of mindfulness practice every day for 3 months can reduce suffering and increase happiness.
That's great. And I know there's different ways that mindfulness help people. I know one is that it helps you become here and now focused. Because generally when we think about the past, we're thinking about how we messed up or how somebody wronged us or how something went poorly. And when we think about the future, oftentimes you're thinking about how things might not go so well or something bad might happen. So if you're focusing on the now, and then you're not having a lot of these negative predictions or negative memories, which makes you more grounded.
Yeah, exactly. And that actually kind of brings me to like another part that I think is really cool about dialectical behavior therapy, which is that there are these dialectics. And what that means is that there are 2 things that are seemingly opposite. Well, they are opposite. And it seems like they can't exist at the same time. So you could think about one dialectic is thinking about the past, like you're stuck in the past, thinking about where you went wrong. The other side is thinking about the future, worrying about what you need to do tomorrow, worrying about what's going to happen in the pandemic. The goal is actually to get in the middle. And so the middle is the here and the now. So there's a spectrum, and these dialectics come up all the time. And the goal is like, once you find that balance, once you get in the middle, that's where you're that's where the reduction in suffering can really come from.
It kind of makes me think about me when I'm trying to eat healthier. Like I want to eat really like amazingly tasty food, but I also want to eat like really healthy food. And it seems, and I mean, unless you're like, I mean, I know some people are really good cooks and they're able to just like combine those together.
Not
but
me.
Yeah, no, not me. I mean, even though I'm doing this from my kitchen, what I do here is very, very basic. So it sounds like a dialectic there, like sort of finding it in the middle where it's healthy, but tastes good enough so you could eat it. And it sounds like, at least coming from this dieting sort of metaphor, that it makes it more sustainable, that if you find yourself in the middle, that you're able to persist longer.
Yeah, totally. Because I think with food, on one side will be, sticking to this really intense diet of like raw food and vegan, and that's totally fine for some people. On the other side, it might be binging junk food. So everyone's spectrum might be different. Everyone's middle might look different, but it's thinking all about as humans, we flip-flop so easily between the two opposites. So I think if we're able to get in the middle, with food or with our emotions, that is where we will have this aspect of feeling really peaceful.
So how does someone know that they're in a dialectic like situation? How can they identify it and maybe like put it down on paper or mentally sketch it down?
Yeah. So let me actually give you, because the dialectics, they exist all over the world and in your mind on so many different topics. So let me give you an example of one that I think everyone relates to. So remember how I said, like, you're at a 10 out of 10 of emotion? Mm-hmm. So think about when you're at your 10 out of 10, what are you doing? Maybe you're feeling more hot, more mood dependent, more moody. That's your emotion mind. On the other hand, there's something called reasonable mind, which is basically when you're doing your taxes, if someone is giving me hand surgery, I want them to be in reasonable mind, which is just the logic, just facts, no emotion. So the middle is actually called your wise mind, where you're using both emotion and logic. So if you find yourself in a dialectic, you might notice that you are in an extreme. You're either all or nothing, you're hot or you're cold, but something just doesn't feel right. Like you just don't feel like you're really getting all aspects of what's going on around you. So if you're dating someone and you start yelling at them and they did something to piss you off, and later on you're like, shoot, I shouldn't have done that. That might be an idea for you to think, maybe I was in a dialectic.
Okay, so you sort of get that emotional sense that, or I mean, I got cognitive verbal, but you get this sense that something didn't go right. Something didn't go as well as it could have. Like something feels uncomfortable here.
Yeah, like something seems a little off. And I think that's really vague, but in terms of the emotion mind or reasonable mind, that seems more concrete. Like we all get in our own emotion or reasonable mind. So you can actually jot down, like, when am I in my emotion mind? When am I in this reasonable mind? And what does it look like to be in wise mind? Mm-hmm. Or with eating, you can write down, what are the things I'm eating when I'm on this one extreme? What am I eating when I'm on the other side of the extreme? And what does it look like to be in the middle? Mm-hmm. And I think if you're able to really understand what you're doing in each of those extremes, it will help you figure out if you're in that dialectic.
So, a lot of people that like have anxiety or intense emotions, they start mistrusting their emotions. Like my emotion must be wrong. I must be feeling wrong. And they start doubting whether they should be feeling a certain way. So what do you say to somebody that says, well, that's great. You have this wise mind that has the emotion and the reasoning, but I never trust the emotion. Like, I don't know if I should trust that. How could I possibly take that into consideration here?
Yeah, that's really hard too, especially when I'm in emotion mind. Sometimes it tricks me that I'm in my wise mind. I don't know if that's ever happened to you when you're like at your 10 out of 10 and you're like, nope, this is definitely the wise thing to do. Mm-hmm. That definitely happens to me. So I think the idea is when you're in that wise mind place, you're usually not questioning. It's really this kind of intuitive knowing. And there are actually some practices that you can get more comfortable with your wise mind. In the moment, you may not know it, but it's kind of like working out and flexing that muscle. We all have the ability to really trust our emotion, but it definitely does take practice. So I think knowing when you feel that intuitive knowing, or even just when you made a decision that incorporated how you feel and the facts, that's technically wise mind. So it takes practice, but I think part of it is knowing when you made a decision that you felt really good about.
So even when your emotions are really high, is there information that you could then pull from that to get more towards that wise mind?
Yeah, yes. And it definitely takes a lot of practice. I think when at first you may just be looking at what are the things I do that I don't like or that I regret or that are ineffective? Like, where do I get into trouble? So again, on one side of the extreme, it could be self-harming, suicidal behaviors. For others, it could just be feeling more on edge and being more irritable and, and maybe raising your voice or yelling at your kid more. So it's looking at the behaviors of outside of it, where are the behaviors you don't really like or that get you into trouble or make you feel worse. And then you can figure out that's my emotion mind. I think you have to kind of humanize it a little bit and know what your emotion mind looks like.
Yeah. And it sounds, but like in those situations, it sounds like every single time was having high emotion, even though if they didn't like the way they reacted, it signaled something that they weren't happy with or they were uncomfortable with, like their child's behavior or how a partner is treating them or reacting to them. So like what set off the emotion might be spot on for their experience. Yeah.
Yeah. So things can definitely be spot on. And for their experience, I also think, all we can do, unfortunately, is actually change the way that we're responding. I mean, we do know behaviorism and we know how to influence people, but unfortunately we can't control people. That would be nice, rather than changing my reaction to my husband, I'd love to change some of his behaviors. And so all we really focus on is where do you want to be ideally? How do you want to act in these situations? What actually feels good for you? And once you identify that, there are ways that you can actually just practice, even just asking yourself, is this a wise mind decision? Sometimes that can get you thinking a little bit differently, or don't necessarily trust your emotions. They might be true, they might not, but just have a little bit of curiosity about it.
So in this area that you're doing, were there other skills that you're working on as well with people, or is it mostly the tip and the wise mind? Yeah.
So this is talking about the wise mind and the tip, the temperature, and the self-soothing. All of those are really more acceptance based, right? You're not really doing things to change. It's more about tolerating the moment, thinking of, the wise mind isn't really a skill. It's more of a way of being. And then on the other hand, that's where the problem solving really comes in, which more of the cognitive behavioral therapy techniques. And, that's how I kind of think about it. That's really where that comes in, about when you do have control, what can you do to feel better?
And what sorts of things have you been talking to people about in that realm?
Yeah. So if you think about, again, during this pandemic, there are things that we do have control over. We have control over what we eat, how much we exercise, your nighttime routine. I think because when there's a lot of uncertainty, it's really important to focus on what you do have control over and getting a lot of consistency. So there's a lot of research to show that having a consistent schedule can actually, put you in a headspace to feel like you have more control over something. So you can actually think about, if you make a Venn diagram, things I have control over, things I don't. Not really a Venn diagram, more just like circles. And if you put all of your focus over to the things you do have control over, then we may, challenging your thoughts can be one thing that you have control over. Or if you have a lot of fear, anxiety tells us to avoid. So if I'm working from home and I don't, it might be a lot easier to avoid. I will clean my kitchen and my house before I write my notes for therapy. And so it could be about, rather than avoiding, how do I engage? And it could be setting up little exposure experiments with myself to write a schedule and do these things I have to do and rate my mood before and after.
Yeah. And a principle that, a big CBT principle is that when you approach what you're scared of and it's relatively safe, over time it drops the anxiety versus when you avoid what you're anxious about, it increases anxiety. And that's why you'll see, very simply, like phobias. If somebody is scared of dogs or water, the more they avoid dogs or water, the more scared and the more they have to distance themselves and avoid. So approach makes you feel better. Avoidance makes you feel worse.
Right. Except in the immediate, it feels nice to avoid that, that dog, right? Like right away you have a drop in anxiety, but then you learn, in order for my anxiety to go down, I have to avoid this dog, which is just, reinforcing that cycle and making your anxiety increase. So this is all about approaching. And when it gets to be too much, and when you have urges to do things that are ineffective, then that's when you use these other like self-soothing or more acceptance skills. But the whole idea is really to change your life to get it to where there's a lot of meaning behind the life that you're living.
Yeah, and that's a great point, that when you do approach what scares you, you do feel worse a bit in the short run. And hopefully by the time you're done, you feel better. But it's more of like a long-term strategy of feeling better. So you're going through some emotional pain now to help future you have less emotional pain with the same situation.
Yep, exactly. And that can be really hard for people because it sounds so, if this is your first time hearing that, it doesn't really make sense. And it's not naturally humans avoid discomfort. So it's a really hard, sometimes it's really difficult to get someone to move and approach when naturally we want to avoid discomfort.
Yeah. And I think that's where, if it's really hard, that's where like therapy comes in, like when people come in and they're scared of embarrassment, I will go out on the streets of Manhattan with them and we will sing and dance and march and read speeches. And I've done, whole job interviews on the street corner, because if you could do a job interview by Grand Central where there's thousands of people walking around you, it might make it a little bit easier to do a job interview in front of 3 people, even though the street people are having a bigger evaluation of you. But the idea is that we go outside and we do the things that scare you so you can learn that you could tolerate and be less scared of it.
Yeah. And that's a good point. I forgot, because I was also living in New York, and actually I was running a social anxiety group for teens. And, if you know anything about New Yorkers, their faces can be really scary. And so after this 8-week social anxiety group, we went to the subway platforms and literally sang and welcomed people off the train, which is scary for anyone. And can you imagine? It's so scary for someone who has anxiety. And it's like, if you can do that, if you can go to the platform and sing and welcome New Yorkers off the subway during rush hour, you're golden to speak up in class.
Exactly. And I would do that in front of Grand Central. We would block doors. Like, there's a bunch of doors. There's like 8 doors, and we would block like a door, and we would greet everybody that was coming in. So same, but just in a different area.
Yeah, Grand Central is really, really bringing that up.
Yeah. My office is close by there, so it makes it easy for me to get to. So that's a great point. But in the way that you practice, it sounds like when you're doing exposure and the exposure has tilted you over the edge, that you advise using one of the coping skills.
Yeah. So like let's say you're about to do an exposure, but then you get to a point where you're like, I can't handle this and I'm going to do something that will be harmful. Then that's the point where we bring in the other strategies. But I'm very, a lot of this is actually in dialectical behavior therapy. A lot of it is actually emotional exposure. And so it's just about experiencing the emotion without acting on the urge. So I'm always thinking about exposure, but sometimes it looks a little bit different.
Okay. Yeah, I see what you're saying. So more of like feeling and learning how to tolerate feeling bad.
Yeah.
And sort of sitting through it, but then when you can't do it anymore, having the skills so you feel like you have a safety net.
Exactly. Yeah.
Yeah. And with emotional exposure or having better tolerance to distress, that takes time, right? So the more and more that you do it, the more of a callus you get, and that callus gets stronger and stronger, so you could tolerate for longer and longer.
Exactly. And I think that's really where therapy can come in. So there are a lot of great self-help books out there. And I think once people go through those, cognitive behavioral therapy or DBT books on their own, and they're still feeling stuck, that's really where it's helpful to have a therapist guide you through. Because again, naturally, we avoid discomfort. Mm-hmm. And so there's going to be a point where you might say, like, I'm not going to do this, or like, why would I do this? It's really hard to get to that point. So having a therapist guide you through those exposures can be much more effective.
Yeah, and oftentimes when people are thinking about anxiety or other sorts of negative emotions, they think purely about the intensity of the anxiety and wanting to dial that down. But just like there's pain tolerance, there's anxiety and distress tolerance. So if you have more anxiety or distress tolerance, you're able to operate and tolerate higher levels of anxiety, distress tolerance, just like how people could tolerate different levels of pain.
Yes. I love that, because I talk about your emotional kind of tolerance in terms of salsa.
Oh, and like the dancing or the food?
The food. So,
the food.
If you give...
I was thinking dancing. I'm glad I asked.
Funny. If like a ghost pepper is really freaking spicy. Mm-hmm. And if you give people a ghost pepper, most people will be like, this is really spicy. And they will feel it, like their mouth will get inflamed. It will be red. But if you give some people, like my friend Jenny, mild salsa, she thinks it's really spicy, like a ghost pepper. She actually her mouth gets inflamed, it gets red. And so the idea here is we all have different tolerance to emotions, and it's to keep eating the mild and the medium salsa, to keep exposing yourself to those emotions, so that at some point your tolerance for emotions will be higher, and then you can actually experience more without feeling the need to avoid or act impulsively. Mm-hmm.
So I guess in a nutshell, it's not just about bringing down anxiety, but bringing up how much you could tolerate anxiety. And I keep saying anxiety, but also any sorts of distress. I just keep saying anxiety because oftentimes people are coming in with anxiety, but there's anger, sadness, guilt, embarrassment, and a whole list of negative emotions that this is true for.
Yeah, exactly. Yep. So the whole idea is about exposing yourself, tolerating emotion, and because unfortunately, we can't get rid of pain in our life, right? We can't, the sadness and anger and guilt, it's all hardwired, and it's there for a really good reason. Mm-hmm. So we don't want to get rid of it completely. And so that's where the tolerance piece comes in. That's really important about how to have these emotions and still live the life that you want.
Yeah, and I think it also comes down to triggers. Like we always have triggers in our life. And I think a bad message is that, it's good to know what your triggers are. So if you could, reasonably avoid some triggers like that's an okay model, but just avoiding triggers as a mantra is not a great thing. It's how do I regulate when I do hit a trigger with some reasonable trying to not getting triggered too often.
Yeah. And when you're saying that, I'm actually thinking, if you go around the world trying to remove all of your triggers, then there's a part where you're actually fighting reality. And that's where radical acceptance comes in, because there are triggers. So I think radical acceptance is accepting reality with your entire heart, body, and soul. There are triggers. There will be times that I have urges, and I can experience these emotions and be okay.
Mm-hmm. So by definition, I think when a lot of people hear about radical acceptance, because you hear the word radical meaning extreme, acceptance being acceptance, means I'm just going to accept everything in life. Okay, I'm done.
No.
Yeah. So what is radical acceptance?
Yeah. So radical acceptance this is where, like, when you start to fight reality, or when you're kind of disconnected from reality, radical acceptance is basically just saying, this is what it is. Like, this is the reality I'm living in. And it's using your mindfulness skills to know what reality is. So if, in order to going back to the example of me working from home, in order to get to radical acceptance, I first have to be aware I'm in pain when I'm not at a desk. I have to be aware that I'm taking a lot of time to set up my workstation every day. So you use mindfulness to really be aware of what's going on. And then radical acceptance is with every ounce of your heart, soul, and body, just accepting this is reality. And then you're like, okay, what parts do I need to change? But first, it's just accepting it as it is.
See, I love how you're putting that kind of like in stages. So it's accepting the situation and then figuring out what you can change and trying to reasonably implement that change.
Exactly.
So acceptance doesn't mean do nothing.
Right. Again, because I think if you're just dunking your head into a bowl of ice cold water, which is more of an acceptance skill, your life problems will not be solved.
And I'm not sure if you have an answer for this, but how do you help people recognize what they can and can't change so they know what to focus their energy on?
Yeah. So first, sometimes it's easy. Like sometimes they know what they can change and what they can't. The things that cause the most negative emotions are usually the things that are hardest to control. Mm-hmm. So it could be a recent breakup. And you could be thinking logically, of course I know that this is reality, but I think there's an emotional part where you're not fully accepting. So I might ask like, what are you doing? Like when you're feeling really sad, what are you actually about this relationship? What are you doing? So for some people, it could be rereading old text messages, or it could be fantasizing about getting back together. Those are signs that you're not fully accepting reality, or fully accepting reality in the way that we think about radical acceptance. Mm-hmm. You might be, again, logically saying like, okay, I'm not texting them, asking them to get back together, but emotionally you're not on board. And so it's first figuring out like, what are you doing that's getting you feeling stuck, feeling icky, or bringing up those negative emotions? And then it's about, okay, so the next time you have, what would you be doing if you had fully accepted this breakup? You probably wouldn't be rereading old text messages.
Got it. I see. So yeah, you could use your behavior as sort of a thermometer for how much acceptance that you are having.
Yeah. So you can look at the behaviors and then the emotions as well. So if you're feeling fine, if you're feeling great, then, and you're not fully accepting reality, then it may not be as much of a problem for you. But if you're feeling really stuck in the negative emotions, that's my cue to look at what behaviors are you doing to make those emotions stay around longer. Mm-hmm.
And one CBT skill that we do to try and figure out what to focus on changing is like a simple question. Can I put it in a to-do list and do it? Because if you can make a to-do list and do it, that means that it's something that you could change. Like for example, I just re-signed my lease. But if I was thinking like, I'm really worried where I'm going to live next year, and I say, well, can I put something on a to-do list that reasonably will help with that? The answer is no, because no leasing agent is going to talk to me about a place in a year unless I'm looking to buy or some other shit, but say I'm looking to rent. So that's one technique. I mean, there's other techniques I use, but I really like, because it's so simple. Can you make a to-do list, and can you do that to-do list now or in the reasonable near future?
Yeah. So I think, I think with that too, right? If you're right now, I mean, my emotions are maybe, in terms of fear, maybe I'm at like a 3 or 4 right now, maybe a 3. And so you can ask me that question, and it's very easily accessible. If I'm at a 10 out of 10, I might tell you, of course I can put these things on a to-do list. I can put my whole career plan on a to-do list when my anxiety is at a 10 out of 10. So I think that's, again, like just where the DBT skills come in, as your emotion mind might trick you that you're in wise mind.
Gotcha. So you're talking about bring it down so you can more adequately go into like a skill that I had talked about.
Exactly. Yeah.
Yeah. And before the show, you had been talking also with acceptance, like acceptance of disappointment, acceptance of maybe, and I know that you touched on this a bit, but acceptance on things that we can't control. It sounds like you've been thinking and doing some work in this area as well.
Yeah. So I think primarily with everything going on in the pandemic, there's been so much disappointment. I think for high school students seniors who couldn't have their prom, who couldn't have their graduation, for college students who were in their first year of college and had to go home, or for parents who are seeing their kids feel so sad about not having their birthday party or going to their friend's birthday party. I think there's just been so much disappointment. And so I've really been thinking.
And with adults, though, also people we're going to start a new job, or people have been laid off, or some people are going to try and have kids and now they're worried, should I try or not? And some people are choosing not to. People have had to move out of places. So across the board, adults, kids, adolescents, there's a lot of loss or disappointment.
Exactly. Yes. For me, I had all these trips planned and it was super disappointing. So many weddings, friends' weddings that were postponed or canceled. I think there's just been disappointment everywhere, even on Mother's Day, not being able to see my own mom, or, not being able to just connect physically with people, I think has been really, really hard. So I've been thinking about ways to just actually deal with disappointment. And I think, again, naturally as humans, we like to avoid pain. And so there could be a part where we just push away, or we may see behaviors that come up for us that we don't really like when we're feeling disappointed. But the idea is to really, if you just sit with the emotion of disappointment, if you just accept that, and experience the disappointment, you can actually start to see the intensity of the disappointment start to decrease, rather than to just avoid and think, nope, this is fine, this is fine, this is fine, when really it's not, and you're really upset. Mm-hmm.
So it's almost like that acceptance piece, or that sort of tolerating intense emotion, it's tolerating the disappointment.
Yeah. It's tolerating the disappointment, really experiencing it and allowing it to be there. And you can even ask yourself, when I'm feeling really disappointed, what am I thinking? What are the thoughts that are coming up for me that feel really disappointing? And if you can actually just track that, you can maybe write down, when I'm feeling really disappointed, what am I thinking? What does it feel like in my body? Maybe you notice your heart rate starts to increase or your hands get sweaty. It's just about sitting in that for a moment, and to recognize it's totally normal to feel disappointed right now.
Mm-hmm. Okay. So now you're at this point where you're feeling it, you're accepting it, you feel that way, and you're allowing it in. Is there a next step to helping you with disappointment?
So one thing that I actually did again because I started writing a blog. So I started writing about dealing with disappointment, and then I'm like, okay, cool. Now I felt my disappointment. Now what? I actually went into a gratitude exercise by thinking about a few things that I'm actually really grateful for right now. So, and actually spending some time on gratitude can actually increase positive emotions too. So with the dealing with disappointment, I wrote down that there are things I am grateful for. I'm grateful that I get to be around my dog all day long.
What type of dog do you have?
He's like a German Shepherd Sheltie mix. He's a mutt. But now, and it's funny because I take him on so many walks that he just stops walking in the middle of the street now because I take him on way too many walks.
Oh, so he's tired. He's like, I'm done, lady. Bring me back.
He's like, stop taking me on walks. But I love it. I'm grateful for my dog because now I can actually get out of my house more. And I'm in Santa Monica. It's super nice out here with the blue skies. So I'm actually very grateful that I can be outside more, be with my dog. And if you actually spend time thinking about the things you're grateful for, writing them down, maybe five things when you're feeling disappointed, and just focusing on that, it can actually, again, improve your mood, or at least improve the moment.
So it sounds like that's part of taking a perspective taking. So you're focusing on, but you're taking a perspective on the positives in your life. And do you guys do anything else with perspective taking?
Yeah. So I think with perspective taking, it could look like a lot of different ways. For the gratitude, you definitely are shifting your perspective of, and I think part of it is not the perspective shifting isn't avoiding or negating the disappointment. It's more once you've experienced it fully and you're like, okay, now what? But perspective taking is really helpful when you're thinking more negatively. So if you're having certain thoughts of, I'm a failure or I'll never be able to do this, perspective taking is, becoming a detective, putting your detective hat on and looking for alternative facts or evidence to see if your thought is supported or not.
So like, I say I usually say like a scientist. But mine's a little bit more nerdier. You're just a bit more fun as a detective. But yeah, so what proves this point? What doesn't prove this point? And let's look at all that data like a scientist or a detective and come to some sort of conclusion.
Yeah, exactly. Because even with the disappointment, like there could be things where you actually have maybe some distorted thoughts or maybe some more negative thinking patterns or mind traps. Those are all kind of different ways to say the same thing. But when you're in a depressed mood, your mind has more negative thinking. And so we can't, we want to put a little bit of distrust into those thoughts and actually become a detective or scientist and look for all of the evidence to say and to notice if that thought actually is true or not true or helpful.
And something just like we have confirmation bias, cognitive filter confirmation bias, that when you're feeling down, you have a bias towards seeing and accepting negative things. And you have a bias towards rejecting or disqualifying or not even attending to positive things. So I think this also helps with that cognitive filter confirmation bias, because you're saying, okay, I'm going to look for the positives in order to bring that in, because the natural state is pushing it out.
Yes, exactly. And I think even remembering, like when we're we just taken all of those negative data. And when we think back, it's just easy for us to think back to times that we, just going with the failure theme, it's then easier to think back to times when you have failed. And it's really hard to think of times when you've succeeded or done something well.
Yeah. And I think disqualifying positives is actually an important principle here, because it's easy. Sometimes, even if it's not easy, you could remember times that you succeeded, but you could then shut it down by disqualifying it. And the funny phrase I always say, like, mind your butts, because you'll say blah, 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 but blah. So like, for example, someone says, hey, Jason, you look nice today. And I say, oh, but Jen's just a nice person. So she would say that anyway. So I completely threw away the compliment with a but statement. It doesn't have to be a but I often phrase it into a but we do it all the time. And so in the failure model, well, I was able to graduate this thing, but so did 10,000 other people. So,
I like the mind your butts. It's a good way to think about it. And we do it all the time. I think even, just bringing awareness to the fact that, I like the phrase mind your butts, because then when you're living in life and you notice yourself saying but, it can actually kind of cue you to think about it a little differently. Yeah,
how you're disqualifying the positives. And, one technique I'll do in the therapy session, where I often have people log against their like, I'm not smart enough, I'm not pretty enough, or whatever it might be. I'm not good enough at my job. I'll log the opposites, and I'll go through, okay, like, what are the things that you wanted to put down, but then you said that they don't count? And then we'll go through and see if they minded their butts. And sometimes they were right to disqualify it because it wasn't a really good piece of evidence. But there's a ton of times where the person has thrown something out where really, if the filter wasn't so strong, they would have seen that was actually a pretty good piece of evidence.
Yeah, totally. I think our minds and our mood can just kind of take over sometimes. That's why I call them mind traps too, because it really does trap our mind when you are in a certain emotion or a certain space, that's the data that you see. So becoming a detective or a scientist to look at all the evidence, it sounds easy, but it actually can be really challenging sometimes to think of everything. You're not disqualifying. You're taking in all of the alternatives or all possibilities to look at.
All right. So with the disappointment, we have first step is taking the acceptance, feeling it, accepting it, not disqualifying the way that you're feeling or saying that you shouldn't feel a certain way. And then doing focusing on what you're grateful for. And then also within the disappointment, looking at how, whether or not you're completely accurate with your thoughts of disappointment. Were there any other techniques that came to mind on what you've been talking to people about in this area for taking those next steps?
Yeah. And I want to go back to the gratitude thing, because I think the gratitude aspect of it could be something helpful, but it's not necessarily like whenever you're feeling disappointment to go through the gratitude exercise. I just think it could be a way, if you're in that space and you're feeling more stuck, to actually, again, just look at it a little bit differently. But that's not to say that you always have to do a gratitude exercise when you are feeling disappointment.
And just at the end, do you have any resources or plugs that you want people to connect to? Like, for example, your blog, if people want to keep reading about what you're doing or seeing what you're doing or anything that you're going to be like presenting that might be online, like how can people see more of you?
Yeah, so definitely. I have a website, and it's my first name, last name.com, ericarozmid.com. So it's just ERICAROZMID.com. And I have a blog going, and I'm going to be updating some of the workshops and may actually put on some of the slides for these skills that I've been teaching online so that people can access them for free.
Oh, cool. That's awesome.
Yeah.
And you might not have any now, but are there any resources that you think would be helpful for people, whether it's like a book or a website or something that you would recommend? And all these things that you're talking about, I'll put in the show notes. And if there's something afterwards that comes to mind, I could also add those into the show notes afterwards. I was just wondering if there's anything that popped up.
Yeah. So I think in terms of the DBT books, a lot of the books that I use are really within a therapy model. So those are the books that you would actually go to a therapist and see. There aren't any self-help books within DBT that I've used, but for CBT, there's, thinking about tools that you can actually go through on yourself. One I really like, if you're feeling more depressed, is Mind Over Mood. That's a really great self-help book. And recently I've been actually listening to some podcasts and reading a book called this is kind of separate, Overcoming Intrusive Obsessive Thoughts. And it's about like, we all have thoughts that we don't like. And so, thinking about thoughts you have when you're at a 10 out of 10 out of emotion, and ways to have the thoughts and still do what you need to do. And it's kind of similar to having emotions and still living the life that you want. So those are two that I like, and I'll send you some others that are more maybe DBT related self-help books after.
Okay, great. Well, I really appreciate you being on the show. I think these were amazing topics and amazing points for the current times because it's so relevant. But I think that these go way beyond the current situation. I think people use a lot of these skills just throughout the lifetime at most age ranges.
Yeah, I definitely agree. And I really appreciate you bringing me on the show. Again, I would encourage everyone to try, if you are going to think about trying these skills out, to know it is like getting a six-pack, which is hard. You don't just wake up one day and have a six-pack. You have to work really hard.
Not like a six-pack of... Yeah. Okay.
Yeah. You're like, what am I? Not a six-pack of beers, six-packs of abs. And you have to work really hard, but it's worth it. And it can definitely bring you some more emotional freedom.
All right. Well, thanks for coming on, and we'll keep in touch, and hopefully another time you'll be able to come on the show and talk about some other, topics that you've been working on.
Okay, great. Thank you so much.